Hi, my name is Kaya Fordham,
And I'm Sandra Nakuzar.
and today we will be discussing universal healthcare.
The case we will be discussing deals with the issue of whether or not federal government is obligated to give their citizens free health care. Over the past century, individuals have argued and discussed whether universal health care is necessary. After the New Deal, created by Franklin Roosevelt in the 1930s after the Great Depression era, Social Security was passed in order to allow senior citizens an opportunity to have a fiscal safety net during the later years of their lives. In addition to such reform in the United States, the liberals sought a universal healthcare system to protect us Americans from illness and the stress of paying medical bills. For this reason, Medicare and Medicaid was established. However, these programs do not meet the full potential of a universal system of healthcare that can benefit all Americans rather than the select few.
We believe that universal healthcare is right and it should be free for all citizens who reside in the United States. According to Buchanan, based off of rights, the government should provide healthcare for its citizens. Also, based off of beneficence, it is the duty for the government to provide for those in need. Even though the government is not necessarily responsible for healthy people, they are obligated to provide people with an opportunity to be healthy. And failure to achieve this public health arrangement means that there are reasons for standards of injustice. Even if the government doesn't provide full health care, they should at least be responsible for the minimum health care coverage.
According to utilitarianism and utilitarianism justice, it states that a just distribution of benefits and burdens is one that maximizes the net good for society. If the people in the United States are healthier, they will miss less work and ultimately will work better in their jobs. Working more hours on an individual level gives workers more money and increases profit for companies.
In Canada, they have universal healthcare coverage with excellent health outcomes. They have minimal paperwork and also high public satisfaction. And avoidance of risk selections is also a key advantage that they have. The United States has more uninsured people than Canada's entire population. Without knowing that health is a necessity to achieve other aspirations, as well as human rights being dependent on how healthy a person is. With access to proper health care, people will begin to take care of their bodies properly instead of only going to the doctors or getting checkups when they're really sick, when it could be too late to help them. Universal healthcare coverage could also decrease discrimination, and it will also help with medical bankruptcies, improve public health, also reducing healthcare spending, and extend a lifetime. As you can clearly tell, we are pro universal healthcare. That is all. My name is Kaya Fordham.
And I'm Sandra Nakuzar.
Thank you.
Thank you.